Good afternoon, everyone. I am Monica Payne from CDC's Office of Public Health Preparedness and Response, Division of Emergency Operations, and I'd like to welcome you to today's Crisis and Emergency Risk Communication webinar titled Community Engagement. Today we will hear from CDC's Kelly Waters, who is a Senior Health Communication Specialist. If you do not wish for your participation to be recorded, please exit at this time. You can earn continuing education units by completing this webinar. Please follow the instructions linked in the invitation you received. The course access code is CERC 0808, with all letters capitalized. To repeat, the course access code to receive continuing education is in all caps, CERC 0808. Today's webinar is interactive. To make a comment, please click the chat button at the bottom of your screen and enter your thoughts. To ask a question, please use the Q&A button. The Q&A session will begin after Kelly has presented. We will now transition to our presenter, Kelly Waters. Kelly currently supports the Emergency Risk Communication Branch, which oversees the CERC program. Kelly has over 15 years of experience in public health communication. She has provided communication support during emergency responses, such as H1N1, Ebola, Zika, the 2017 hurricane seasons, and many others. Previously, she served as an editor, media liaison, and public information officer to internal and external partners, including congressional correspondents. She currently leads the CERC program and has conducted numerous national and international trainings on the subject matter. Thanks for joining us, everyone. Kelly, please begin.
Thank you, Monica, and welcome, everyone. Today we are going to discuss CERC's Community Engagement chapter. This is a brand new chapter in the CERC curriculum. Although it does cover some previous content regarding stakeholder and partner engagement, it is also going to incorporate a lot of new content based on our last several responses that CDC has been involved in. So I hope you guys find it engaging. First, though, we're gonna go over some basics. So if you have participated in the last few webinars, the last 3 webinars that we did were the core of CERC, Introduction to CERC, Psychology of a Crisis, and our Messages and Audiences webinars. If you participated in those, please bear with me. It's going to be a little bit of a review, but I want to make sure those of you who weren't able to participate in those webinars have the foundation to discuss community engagement, because that foundation will really help you understand today's discussion a little bit better. So just bear with me for a few minutes to discuss those basics so that we can all start on the same page. Okay. Sorry, guys, I'm having just a, oh, there it is. Okay, so CERC principles basically help you do the best you can with the information you have in a bad situation. I know that's a little bit of a downer, but it's not supposed to be. The idea is based on a lot of study, based on experience in this field. We know that using these principles, we can take the information that you've got, however little it is, and use that information to help people make the best decisions that they can within extremely challenging time constraints and imperfect options to keep themselves as safe as possible and to help keep their families and their communities as safe as possible in crises, in emergencies. So it sounds discouraging, but it's really making the best of a bad situation using these tools. The right message at the right time from the right person really can save lives. It can really improve people's circumstances. What people hear, what you say, when you say it, okay, it's crucial, that timing, and who says it, who they get that information from, that resource, that trusted resource. matters. Okay, it really can have an impact on the actions that people take in an emergency. So a little bit about the basics, a little bit about crisis and emergency risk communication. Public health, just like clinical health, right? You have emergency rooms, has to be on all the time. We have to be ready to go 24/7. Unfortunately, infectious diseases don't have a 9-to-5 schedule. They don't just wait to happen when it's convenient for us. So when things like when Ebola outbreaks happen, they need people to do contact tracing in the middle of the night. You know, we need to be available, just like clinicians at all times. So whether threats are here or abroad, whether they are small or large, whether they're natural or intentional, we are always going to have to be ready to respond and ready to have new ways, ready to communicate so that people can have options, so that people can have advice, so that people can have recommendations for protecting their health. CERC was developed in 2002, and I've already said, you know, we've responded to several different kinds of emergencies, but it was initially developed in response to an infectious disease outbreak. It was developed in response to H5N1. It was a bird flu in China, and it was based on the studies of emergency response, the studies of psychology, those sciences, communication science, and experiences in emergency response. But it was also combined with adult education over the years. It's been this combination of a variety of sciences and expertise that had turned into a curriculum, had turned into an actual course that was taught at Tulane and has been really a foundation of CDC expertise in communications and emergency communications. What it has become recently is more of a framework for responding to emergencies, something that we're hoping people can use as a quick reference to be able to use before emergencies happen, something that they can study and learn from prior to emergencies, that they can prepare for emergencies, but also something that they can quickly reference in an emergency. So something that they can remind themselves, okay, what were those principles and what were some things that I needed to remember, and how would I start a good message? So something that's more quick access and easy reference, an easy guide to use, something that they don't have to muddle through when time is of the essence. And what CERC essentially boils down to is these 6 principles. Be first does not mean that you have to be very first to say anything. Be first means that your organization in an emergency needs to be first to speak to your expertise. So where CDC is concerned, it is our job to be the first organization to speak to public health in an emergency. When there is a crisis that affects the public's health, we need to be available, we need to be present, and we need to be ready to speak to that issue. Now, that gets us to be right. What if we don't have all the information? Well, that's okay. We need to speak to what we do know. We need to share any information that we do have available, but we can also say what we don't know. You know, crises are rapidly evolving situations, and we don't have all the information. So what we can say is what we're not sure of at that moment, but what we're doing to get that information. Sharing a process is sharing information. Sharing a process is a message. That is still communications. Shocking, I know. But that lends credibility to your organization. If you're willing to share the process, it makes people feel like they're part of the process, right? If you can help them understand what's being done, then they can understand that something is being done. They're not just in the dark about everything that's going on. And they're not just waiting on answers, right? At least they understand what has to happen to get those answers, right? And expressing empathy, saying that you appreciate their frustration. You know, we're what we're doing to get these answers, but we appreciate your frustration that this is taking so long. Expressing empathy that this is a scary situation. Using those words, frustration, scary, demonstrates that you're really paying attention to what people are going through. It really shows that instead of saying, I know what you're going through, that you actually are paying attention to the situation. And that actually also helps promote rapport with a community that's been affected by an emergency. And the reason that all of that is important, the reason that you want to have this connection with a community that's been affected by an emergency is because you want to be able to relate to a community. You want to hopefully establish trust within a community because you want them to be able to respect any advice, any professional recommendations you share, so that they will hopefully believe that you're sharing information that has their best interest at heart, and they'll be willing to take any actions that you promote. This is what CERC comes down to. You want to promote actions that improve the public's health, because there will never be enough one-on-one first responders. There will never be enough of us ever to individually help every single person in an emergency that's going to need help. When hurricanes, when natural disasters of any kind, when infectious disease outbreaks, when any public health emergency happens, there's never going to be enough of us. What we need to do is communicate well to encourage people to take positive public health action steps to protect themselves. That's what this comes down to. And we need to do that respectfully. That shouldn't have to be a principle. Unfortunately, it is. And the reason it is understandable. Of course, people affected by an emergency are primarily thinking about themselves. They should be. They should be thinking about their family, their losses, their concerns, their resources. How's my home? Is it still standing? My finances, do I have a job? Is my business still available? Are my kids, or my family, or are my life still in order, right? People affected by an emergency have very me thoughts. And that's totally natural. They may not be thinking about others. And responders, unfortunately, may be very, very focused, even though their initial motivation for taking a first responder job is probably extremely well-meaning. In an emergency, they may be very, very focused on the task. They may have tunnel vision about what needs to be done, what needs to be happening. And this is a reminder, the sixth principle that we all need to remember to show respect in these situations and in our communications. Okay. The CERC rhythm is also a reminder that while we can do as much as possible ahead of time, and we should, In the preparation phase, we're taking classes, webinars, having discussions about what we can do ahead of time to prepare, to get ready, drafting messages and testing them out and seeing what may or may not work, and developing partnerships and meeting our community members and determining who's in our communities, what languages do they speak, what kind of need, do we have translators, will we need translators? If we will, where will they come from? You know, making those preparations so that when we have an emergency in the initial phase where you see those principles show up, the express empathy, promote action, where CERC happens, where the emergency happens, so that you're ready to go. This is where our messaging constantly evolves. The rhythm is a reminder that crises evolve, so our communications have to evolve too. Now, the maintenance phase, you have a little more time. You're still in an emergency, but it's kind of a pace, if that makes sense, to an emergency. So you have a little more information. You have a little more time. You might be able to provide some more background information. You might be able to provide some more details, answer some questions, address some rumors. And resolution is what it sounds like. You're getting close to resolving the incident, whatever that is defined as. So it may be a new normal for some, but it's a really good time to educate people. It's a good time to educate people on what if something like this happens again? Something like this, something similar, something completely different. Do we need a preparation kit? Do we need to restock the kit that we had? So all of this is to say that your crises are constantly going to be changing, and your communications need to constantly be changing too. And that's why at the top we have evaluation. Evaluation used to be a fifth phase of this rhythm, and it's at the top because it's something that you should be doing always. If something's not working, if the message isn't working, you need to change it. There's no point in continuing to share messaging that doesn't work. You need to make it better. And the way that you do that is engaging your community. Asking them, right? Asking them what they need to hear and how they need to hear it, and making it better and useful. So how do we do that? We're going to talk now about community engagement. So thank you to those of you who have sat through the previous webinars for humoring this review. And for those of you who didn't, I hope this was helpful in getting us all on the same page. So community engagement is a new chapter, like I said. We used to talk about stakeholder and partner engagement as part of the previous CERC manual. So some of that is included, but this is a brand new chapter. It includes some of that information, like I said, but a lot of this is also new. And I don't really read overviews, but this is some of the stuff we'll go over. These slides are available to you on the webinar webpage. So if it's something you want to look at, this is what we'll be discussing. Essentially, though, the goal of community engagement is to reach as many people in an affected community as possible so that they can take the information we give them and make the best decisions for themselves, for their families, and take the best actions that they feel they can take. It's pretty straightforward, or it sounds that way, right? What I mean by that is there are often sub-communities within communities, right? So we have geographic communities. You could be divided up as a town. We think of a community as maybe Whoville. So I'm already seeing Halloween decorations out in the stores right now, right? It's July, so that's natural. Oh, it's August now, isn't it? So it's more appropriate. We'll start using Christmas things. Whoville's a town. But within Whoville, you have the Grinch, right? And then you have the Who's. You have all these little sub-communities, right? So how do we reach all these different populations? This is how CERC defines community. Community is any group of people associated by a common tie or interest. So the geography, the location could be a community, but within that community, you could have a religious community. You could have the business community. You could have a yoga community. You could have the cycling community. You could have the theater community. Age, sex, race demographics could break the communities down even further. So you have all these different populations that just make community more specific. And you could have overlapping communities because of these things. You have people in several different communities that could overlap. They could be in several. The idea is, how do you reach as many people as possible? And the reason this matters is because different communities have different concerns. They have different perspectives. And that means they have different communication needs in an emergency, but they also have different resources. They have different capabilities, right, for reaching out to people and for spreading messages. So they're also a really great partner in sharing communications. Communities are essential in communicating during emergencies. We cannot, as external agencies, just guess and do this without them. Now, that said, as in outside of emergencies, you're going to have different subsets of interest in your messaging inside of emergencies. You're going to have people that are team you. You're going to have people who entirely support your organization. They definitely believe that you have their best interest at heart. They trust your evidence. They trust your motivation. They trust your guidance. And they're willing to follow your advice. They're willing to share your advice and promote whatever recommendations that you're promoting to the community, whatever actions you're promoting. So your advocates are extremely valuable. You definitely want to keep working with your advocates in an emergency. Ambivalence in an emergency maybe are people who never even heard of your organization prior to an emergency. I have worked at CDC since 2002, and I still have people who don't know what that stands for in my life that I come across, and that is okay by me because that means that they haven't had to deal with a public health emergency, which means that they feel safe and secure when they go to sleep at night. And that's great. It's a bit shocking to me, but I hope they never have to deal with me. I hope they never have to deal with me. In an emergency, I hope that I'm able to convince them that we're a trustworthy resource for public health information. That if we are giving them some kind of guidance, that it can be trusted, and given that they don't have any background for what we do or any history for what we do, that we have the expertise and the scientific knowledge and background to support what we're advising them to do. So ambivalence can be a little bit tricky. What we're trying to do in an emergency given limited time and resources with ambivalence, is hope that we can work with trusted spokespeople who are able to potentially engage with them and convince them to consider our advice. Now, there are always going to be people who don't trust our motives. There are always going to be people who don't think that what we are saying has credibility. So adversaries, unfortunately, we don't have the time in an emergency to tussle with. We don't have time to banter during an emergency. We do need to address those messages that can cause harm, that promote harmful behaviors, but we don't have time to directly engage in an emergency. Just be aware that in a community, you're going to have layers of people, and you need to prioritize where you put your energy. Which also leads us to the levels of community engagement you participate in. Just like how much you engage in dealing with advocates versus adversaries, you're going to want to try to decide how much you have the bandwidth to participate in high engagement activities versus low engagement activities. So low engagement activities often require less time, less resources, less direct interaction with directly with community members. High engagement activities require more time, more resources, more direct interaction. So while this isn't a complete list, this is a list of examples that kind of give you an indication of what some of those activities might look like. For example, social media posts don't take extreme amounts of time to draft. They don't take a very long time to post. However, although it's not listed, if you were to do a social media chat, a live Twitter chat, a live Facebook chat, something like that, that would go under high engagement, right? That's a lot more energy, time consuming, to do something that's that direct and live and engaging. So what you want to consider when you're doing something like this is, do you have the staff? Do you have the time? Do you have the resources? If not, you're going to want to choose things that are appropriate to your organizational capabilities that are going to reach as many people as possible. So that's kind of the balance you're looking for when you're trying to engage with the community. Hotlines are high engagement. They can be so great for people to be able to ask questions, to get information, to share information. They can be so helpful for people to call in and tell you what's going on in their neighborhood, to give you information, to help share intel. But if you aren't able to provide the hotline with updated key messages and updated information as it's coming in, then they can't be as great a resource externally as you might hope they would be. Now, something that we discussed in a previous webinar is the psychology of a crisis. It's actually one of the core chapters of CERC. And while we have talked a little bit about considering the logistics, working with the community to iron out the logistics of communicating in an emergency, we also really need to work with the community to get a handle on the psychology of the community. We need to understand where people are in the response, how people are handling the situation, so that we can understand how to message, not just how to get the message out, but how to message. So if people are feeling angry, if they're really, really angry and we're not addressing that, they're not going to be willing to stop and listen to any actions we promote until we've addressed this. If people are feeling hurt, they're likely going to be mad about it. And if we don't address that, we're not going to be able to proceed. People may also feel angry if they are feeling threatened by something else, by something external. A good example of this is actually, there are two really good examples. Flint, Michigan experienced a crisis in the last few years when their water was contaminated by lead, and their local government didn't respond promptly to the situation. And in Haiti, after the earthquake several years ago, response workers who came to help clean up after an earthquake actually contaminated the water, and it caused a cholera outbreak. Now, in both of these instances, the community was threatened, and by organizations and by leadership who was supposed to be protecting them. Being threatened by a risk not of their own making led to greater challenges when other responders came in to help. That trust was already damaged. That trust was really difficult to rebuild. So that anger had to be addressed before we could proceed. And people may feel angry if we don't respect their fundamental beliefs, if we try to communicate over, or if we try to contradict what they believe. I think I've actually used this example on a previous webinar, so excuse me if I have, but it's a really good example. During Ebola, there were some rumors that shapeshifters, people who could change into animals, were able to do so, and they were spreading Ebola in some villages. And this was an entirely reasonable concept that public health could not challenge. Instead of trying to challenge it, the appropriate thing to do is to acknowledge that in this case, although in some cases that may be how disease spreads, in this case we know it's being spread a different way. And work with community members and say, actually, we know in this case, it's something else. In some cases that may be, but in this case, we know it's this. Rather than arguing people's fundamental beliefs, because it's insulting and it's not respectful. It's important that we address people and what they're going through and what they're feeling. And it's important that we do so, again, with that sixth principle, respectfully. And it's also important that we don't make decisions for people, that we don't tell people what to do, that we remember in an emergency that we are dealing with people whose circumstances have changed, although they haven't. So remembering that just prior to the crisis, adults were getting up and they were going to work and they were taking the kids to school and they were packing lunches and they were planning the weekend, and maybe they were taking care of parents, and they were high functioning, independent, autonomous beings. And just because their circumstances have changed and now they are extremely reliant on the help of others because of their circumstances, they personally haven't changed. Their want and desire to be back to independent, back to autonomous hasn't changed. Let them make decisions, help them participate in their own resolution, and help them understand the situation so they can find their own solutions. That is what community engagement is all about. Also, the solutions need to work for them. We need to make sure that the resources are available in the community, that community members know how to enact whatever solutions that we advise. So it's best that community members are part of the discussion. Other things to consider when we talk about community engagement, other things to consider when we're coming up with these solutions, are sources of social pressure. These aren't just questions that are passing. They aren't popularity questions. What will I gain goes along with what will it cost me. So if we say that people should use protection to protect against Zika, to protect against getting Zika and passing it on to, protecting an unborn, if you're going to have a baby. Well, some religions don't support the use of contraception. So if your religious beliefs, if your family's religious beliefs, if your partner's religious beliefs don't condone that, and it's going to cost you the support of your community, you may choose to pass on the public health protection. The gain of public health protection at the cost of your family's support, of your community's support, of your faith leader's support, may not be worth it. This matters. We did focus groups in Puerto Rico during the Zika outbreak and found out that asking a partner in a committed relationship to wear protection to protect against Zika was an indication to that partner that you were potentially being unfaithful. So if it could cost you your relationship, you may not choose to ask your partner to wear protection. It matters, these questions. What are those important to me want me to do? It matters. The public health ramification may be the lesser of the two evils. And it's something that we as communicators really need to consider as serious influences when we're developing public health messages, which is why we have to work with our communities in an emergency. And can people actually carry out what we're asking them to do? This is why we need to know what resources people have. Are they able to carry things out? Are they able to carry out the public health recommendations? And do they feel like they're able? Do they feel empowered to do what we're asking them to do? Those are two different questions in and of themselves. So what can we do? Work with communities. Ask them what are some options. If we're saying you need to prevent mosquito bites, for example, well, how do you prevent mosquito bites? Identify some options. You can wear long pants and long sleeves. Well, what if you live somewhere that's 110 degrees? Let's give some other options. Let's say maybe wear bug spray or stay inside and put screens on the windows. Let's give some options to people that are realistic and doable, and analyze those options and help people decide what might work for them. Give them all the scientific information, give them everything, help educate people so they understand the pros and the cons and what they can and can't do. Help them feel like they understand the impacts of all of the decisions that they may or may not make. And help them choose what we call it the want versus the must criteria. In an emergency, people must have clean drinking water. They must have food. They must have shelter. But they may want to have a soft hotel bed. They may want to have they may want to get out of a stadium type shelter situation, you know, and you can work towards those things, right? But prioritizing the musts and the wants helps with expectations and helps people reach decisions in a cohesive manner. Asking questions of your community, asking questions of community members helps community members kind of really think through. It helps them think through what's important to them, what's really important when there's a problem. Having to say out loud what's important when they have a problem, what risks and benefits are associated with the different options available to them, but it also helps you in that discussion as a communicator. It helps you understand why certain recommendations may or may not be good, why some of your public health suggestions and messages may or may not need to be changed. So these discussions, that's why this is so important. That's why community engagement matters so much. These discussions can make promoting action and the outcome of a response so much better, or in need of so much improvement. On that note, if you want to learn more about community engagement, the entire chapter is posted on our website. You can ask us questions. We do have our functional email box, and it's constantly monitored. But I am also going to be taking questions, it looks like, for the next 15 minutes. So if you guys have any questions, feel free to type them in. If we don't get to them for some reason, you can email questions, and we will try to answer them after the fact.
Thanks so much for that presentation, Kelly. We will now transition into our Q&A. Haley, can you please read the first question?
Yes, we actually have a comment from AC. Why is social media posts classified as low engagement?
Well, so a post is usually short, right? A Twitter post is pretty short, specified number of characters. Facebook post is usually, or should be pretty short paragraph. So the content is usually pretty short, and a post is pretty quick to shoot out, right? It's pretty quick to make happen. Whereas a discussion or some kind of chat is a more cumbersome process. That is why I kind of delineated the two. A post would be a lower engagement, and a chat of some sort would be a higher engagement situation. Now, if you were going to sit on top of all of the comments, if you were going to sit and engage with every comment that somebody wrote back to a post, that would be your choice to do. That would be higher engagement.
All right, thank you for that. We have another question. What if a community or stakeholder group that is originally an ambivalent or advocate becomes an adversary during an emergency response?
So hopefully that doesn't happen, but it can. And it's really important, just like we said with people's traditional beliefs, it's really important to not reject what people are feeling. If they have become an adversary, something has affected them, something has led them down that path, and you want to be respectful and you want to acknowledge the concern that has led them down that path, and you want to find out what it is if you can. Try to engage in a discussion, try to engage in a conversation to find out how they've become an adversary, why they've become an adversary, because also you want to hopefully keep that from happening with someone else. And hopefully what you're wanting to do is listen. So you're wanting to listen to them and potentially rectify the situation with them. You're wanting to prevent it from happening again. And if you can, address the problem. If it's something that you can change, if it's something that can actually be addressed in your organizational actions, then great, then do. If it's something that they just really don't like about response policy, if it's something that they don't like, I'm trying to think of an example, but if it's something that they don't like that has to be done where the response is concerned, then education, then really listening, really engaging, and really trying to, when you've listened, when you've really given them the opportunity to speak, really trying to engage in educating and explaining and leaving the door open to hearing their concerns, if they have any additional concerns, is the best policy.
Thanks, Kelly. We have another question by S.M. Bruce. How much do you rely on local and national media to share your communication? Do you find media a conduit to your engagement approach?
Yeah, absolutely. We haven't done a webinar on media engagement, and I don't know if we're going to, but we're going to do a communication channels webinar, and that will be part of it. We won't do one dedicated specifically to media. That said, using media as a tool, as a dissemination method for communications is extremely important in emergencies. Local and national media have two separate and distinct benefits. Local audiences really know their local audience. So, okay, so to qualify, and I didn't say this when I did the introduction recap, but all emergencies start and end at the local level. That's crucial to know. And local media is extremely familiar with their local audiences. They know their needs, they know their interests, they know the languages they speak, and local media is local. So they also are extremely interested in the same things that the local community is interested in. They want to know what's going on, what's going to happen, who's in charge, all of those questions. So they have the same interests as the local community because they're part of the local community. And national media also obviously has a broader reach. So they have broader reach to more audiences. They have broader reach to more key audience segments, but resources as well. So media is a crucial means of disseminating information to large audience segments. The qualifier there, as we said, with community engagement, we're trying to reach as many people as we can, and media is a great way, traditional media is a great way to do that. When you're trying to tailor messages to those really, really specific audience segments, sometimes you have to get creative because some people don't get their information from traditional channels. Some people get their information mouth to mouth. Some people, by word of mouth. Some people get their information through, community meetings. Some people get their information through non-traditional channels. So just be cognizant of that.
All right, so our next question is, what is the recommended profile for a coordinator of risk communication? And by that, what recommended competencies should a coordinator have if they are involved in risk communication?
An emergency coordinator that's involved in risk communication, so not a risk communicator. So I'm trying to understand the question. Okay.
Yes, a coordinator of risk communication.
Okay.
Say in this case.
Okay. An emergency. Okay. I'm sorry. There are so many different titles. So an emergency risk communication coordinator. The competencies that you should have, I guess I'm trying to clarify the question. If you're asking what kinds of education you should have, well, I have a Bachelor of Arts in Journalism, and several of my colleagues have a range of expertise. The people that I have worked with on different responses from USAID, from WHO, all have varying degrees in communication. So English and you know, they have experience as spokespeople and public information officers and things like that. And they've taken classes like this. They've gotten experience in emergency response. If you would like to email the CERC request at cdc.gov mailbox that I provided at the end of the presentation, I might be able to answer that question a little bit better if I have a little more context for it.
All right, our next question is, would you recommend having your advocates or ambivalents engage with adversaries, or is it best for them to stay out of the discussion?
That depends. This gets to actually, good segue. This gets to next month's webinar and spokespersons. If your advocates or ambivalents are trusted members of the community, if they are well-respected, well-liked, well-spoken members of the community, then it would be helpful if they were willing to share public health messaging on behalf of your organization, not even on behalf of your organization. If they don't even mention your organization, if they would just be happy and willing to share public health information, you know, this is what the best thing for all of us to do is. They don't even have to mention your organization in that capacity. It would be really great. You know, that's how we work really well with our community members. We partner with faith-based organizations, community-based organizations, because oftentimes, you know, the government organization is not the ideal disseminator or the trusted resource of advice. So it's often best to come from somebody who is looked up to in the community.
All right, thank you for that. Our next question is, how do you engage all of your responding stakeholders to enable a unified approach to community engagement? Thinking of a unified command wherein you have public health directors, customs, border protection, airlines, airports, etc., participating in the overall response effort.
Okay, will you repeat the very beginning of the question one more time?
So how do you engage all of your stakeholders to enable a unified approach to community engagement?
The way that CDC does this, and the way that I understand most state, local structures, emergency response structures, have a joint information system. And the way that that's set up is that there is one group in charge of messaging. Communicators from all of those different agencies work together to make sure that the messages are consistent with the subject matter experts from those different organizations. We don't want to contradict each other. You know, border control doesn't want to contradict whatever epidemiology is saying. Epidemiology doesn't want to, you know, contradict whatever, I'm trying to think, well, border control saying, you know, we all work together with the subject matter expertise and the communication staff puts it all together into cohesive, short, simple, hopefully, messaging, and we develop key message documents that everyone has access to make sure that everyone has those available to them, to make sure that we're all saying the same thing. So it should be consistent across the board that that is a desk in and of itself in that unified command structure, that there is a communications component within that structure. That's a FEMA actually structure that CDC follows, that most incident management systems follow.
Thanks so much for that Q&A session, Haley and Kelly. And thank you to everyone for joining us for today's webinar. If you have any additional questions, please email them to circrequest@cdc.gov. As a reminder, today's presentation has been recorded, and you can earn continuing education for your participation. Please follow the instructions linked in your invitation you received. The course access code, once again, is CERC 0808, with all letters capitalized. Thank you once again, and goodbye. Have a good day.